John Hook's Newsmaker starts now.
We're going to talk for a minute about addiction, and so many people unfortunately face this battle. Not only them, but their family, their extended family. And we've seen this a lot across the country, certainly here in Arizona. And we wanted to talk a little bit about it, not just for the people who are high-end celebrities going to the very best posh treatment centers that we all read and hear about. This is about people who don't have means, who need help, and they're finding it at a place called Axiom Care. John Waite is the CEO of Axiom Care. John, thank you so much for being with us. We've talked about so many high-profile celebrities who go through rehab. Everybody knows those stories. But being wealthy, famous, well-connected, this knows no boundaries.
Yeah, absolutely. Thank you for having me on. I have my own personal experience with recovery. 15 years ago, I was struggling, like with so many millions of Americans, struggling with an opiate addiction that I couldn't quit no matter what. Relapsed again and again, and until I finally reached out and asked for help. And because I had means, I grew up in Scottsdale, I went to ASU, I had good insurance, I was able to find treatment and have that available to me at a moment's notice. But once I got into recovery, I noticed that there were so many folks who were falling through the cracks here in the Phoenix area. And part of what we do here at Axiom Care is trying to make compassionate, effective treatment available to every Arizonan, especially the underserved.
That money to really springboard you guys, you've been around for 12 years and done great work. But I think during the Ducey administration, kind of at the height of the opioid crisis, I think there was a recognition universally we have to do something for people who are on the margins, who need this same kind of care and can't get it.
Yeah, absolutely. We were really grateful to Governor Ducey at the time. He had some state legislators from Pinal County who approached him saying, look, we've got folks dying out here in Pinal County. We need treatment services available. And so we were awarded some COVID relief funding to help build a new and expand our Apache Junction campus. We were able to add a new 30,000 square foot residential treatment center so that we could offer a full continuum of care out in Apache Junction, which we're so proud of.
Hey, John, for people who are watching who say, hey, I don't want my tax money going to this stuff, if they can't help themselves, forget about it. Can you talk about the societal impact for having people untreated, maybe on the streets, homeless, maybe unemployable? Can you talk about that?
Yeah, why don't I talk about my own personal experience. Like I mentioned, I'm in recovery myself. I've been almost 15 years in recovery. Back before I was able to find treatment, I was in and out of jails. And we know how expensive it is to incarcerate people. I was doing things that I was not proud of at all. I had become a man that I was not proud of. I was a complete drain on society. Today, now that I've found recovery and that was available to me, I've had the opportunity to be a tax-paying citizen for the last 15 years. I get to lead an organization where we're helping other people, and I'm not the exception. I'm not I'm not special in any way. Anybody who has the opportunity to find recovery is going to do the same thing, is going to be a jump at the chance to contribute to society.
John, a little bit about your own personal situation. You said you grew up in Scottsdale. You went to Saguaro High School. I gather that you partied a little bit in high school, but nothing out of control. Then you go into bioengineering at ASU. You're a very smart guy. Now, people would look at the surface of this and say, John Waite has got the world by the tail. How the heck does he end up addicted? I don't know what your drug of choice was. Yeah. Maybe you can explain. How do you end up there?
Gosh, that's an age-old question, and it's different for everybody. So, but for me, I would say I was a little bit of an angsty teen. I have great parents who are still together and always showed me nothing but love. But I was always searching for something a little bit more, and I found that in opiates. And it was a party for a while, well into college. experimentation and things like that until I found opiates, and things started to go downhill. And for a long time, I thought I could control it, but there reached a certain time where I looked back and realized I hadn't been able to control my use for quite a long time, and it had gotten completely out of control. And that's when I started trying to quit on a regular basis and realized I couldn't. No matter what I tried,
John,
I wasn't able to.
Was your family aware of what was happening to you?
Yeah, not at first, but after, 6 months or so, I'd have to call them from jail and ask them to bail me out. So there came a point where there was no hiding it. And again, they were nothing but supportive, but like so many parents, they had no idea what to do or who to turn to.
That is the part of this that doesn't get discussed enough.
Yeah.
The family gets sucked into this, and sometimes the family, I'm not speaking for yours personally, but the family can be enablers as well. They don't want to admit there's a problem. My kid John is perfect. This is not happening. They don't want to face it.
Right. Yeah, my parents were no exception there. But one thing I would say to any parents who are going through what my parents had to go through is there are support groups out there like Naranon, like Al-Anon, and it was the fact that they eventually accepted that their son was suffering from the disease of addiction, and they needed to arm themselves with the tools that they needed to help, and they went to those support groups. That might have saved my life.
Recovery never ends, right? It never ends. It keeps going.
Yeah.
You have to, even you running a treatment center, you've got to continue to do programs, right?
Yeah, absolutely. There's the saying I like that recovery is a verb. It's not a state of being. It's something you do every single day.
When you get people in, what's the first thing you've got to do? You've got to do the assessment, but you've got to get them out of the environment that they've been in, right?
Absolutely. We have really compassionate folks available to answer the phone 7 days a week. So the first thing they do, if somebody calls us and says, I need help, we don't wait around to make them jump through a bunch of hoops. We'll say, we're so glad you called. Let's get you in. We'll send an Uber if we need to get them to our door to make sure we can get them somewhere safe.
Wow. Okay, so the door is really open at Axiom all the time.
Absolutely. I know from experience, it takes so much courage to reach out and ask for help. So the last thing we want to do is make somebody wait around or make them jump through hoops, to make it difficult in any way for them to access help.
Now, you guys do use medications to try to make the withdrawal and coming off of this stuff more manageable. Is that a good way to put it?
That's exactly the right way to put it. Yeah, we have medical professionals in our detox and our observation units, which is a little bit like a triage that will see our patients every day and prescribe medications to safely withdraw them from the substances they're using, whether that's opiates, fentanyl, alcohol, benzodiazepines, amphetamines, what have you.
Okay, so when they're in there in that situation, it's not a lockdown, right, at your facility? People are there and they have made the commitment to stay within those walls and do the program.
Yeah, absolutely. People can leave. We're not locking you down. We'll strongly try to encourage you to stick around, to continue your recovery and remind you of the reasons that you came in the first place, but it's not a locked facility.
Counselors typically in addiction centers are former addicts. Why that nexus? Do you need to have that understanding of the disease to really manage it in others?
Yeah, we have a lot of folks with lived experience themselves who have, been incarcerated, been addicted, and so forth. But it's not all. There are many people who are trained counselors in addiction treatment who just got into the field because maybe they had a loved one or they were just passionate about helping this group of folks. But it does certainly help. From my own experience again, back before I got sober, I didn't think it was possible. I thought for a long time that anybody who had been as addicted to opiates as I had was beyond help. And it was only when I started meeting people who had been as addicted as me to opiates like me, but who had found happiness in their life, who had built families, who were clearly happy in their sobriety. That was what the main turning point for me to realize maybe this is worth actually putting one foot in front of the other, taking one day at a time and working towards.
John, do we know with certainty the addiction mechanism? Is it mental, physical, both? What is it?
Yeah, it's a little bit of a mystery still, but all the medical, national, worldwide medical groups all agree that addiction is a disease. So I strongly believe, and the science community, the medical community strongly believes that someone being an addict isn't an addict because they're a bad person or they have bad morals or bad self-control or anything like that. They have a disease. And it's a treatable disease. I think that's the biggest misconception, is that treatment doesn't work. It really, really does work.
Please give a pitch for Axiom, if you will, because again, this is for people who don't have insurance or means for high-end treatment. Give us the phone number, give us the website, we'll put it up there, so people who need help can get it.
Yeah, Axiom Care. We are so lucky that we get to. We have the best team around. We have the folks who are so passionate about folks who are struggling. If you're struggling or a family member is struggling, please give us a call, and we can walk you through. What's best for you or your family member. Our website is axiomcareofaz.com. Our phone number is 602-975-2216. Please just give us a call. You don't need to know anything about treatment or the levels of care, anything like that. We have really compassionate, trained folks 7 days a week who will help walk you through.
And it's Axiom, A-X-I-O-M.
Yep, M. Yes, that's right.
John, thank you so much. Really appreciate it. It's great to see you.
Thank you so much, John.
Yeah, we'll do it again. Thank you. John White, CEO of Axiom Care. We're back in a minute on Newsmaker.